Next, we're going to be talking about urinary and reproductive system disorders. So when we look at the urinary system, one thing to keep in mind with the urinary system is it's a sterile system. It starts with our kidneys, and our kidneys have millions of nephrons in it, which help filter all the blood and help pull out the waste products, usually in the form of urea. Then that urea is going to come down the ureters, and your ureters are about 8 to 10 inches long. Part of it is gravity, but also there's some wave-like contractions and peristalsis going on to help push that urine down. And then it comes into the bladder. Now your bladder is a holding tank. It's a hollow organ, and it will vary for everybody, but most people, once it gets around 100 to 300 milliliters of fluid in it, it's going to cause stretch receptors to trigger an impulse up to your brain to let you know you need to go to the bathroom. And then from there, it's going to come out the urethra. Now you have sphincters to help keep the urine from dripping out. Okay, and you learn control over those sphincters, usually when you're potty trained around 2 years of age, give or take a little bit. The urethra for a female is a straight shot. It's about 1.5 inches long, straight shot out to the opening of the body, where for a male, the bladder goes, the bladder comes down and around and through the penis. So 6-7 inches long is generally going to be the length of the urethra. So it is much more common for females to get urinary tract infections. So the first urinary system disorder we'll look at will be those UTIs. Urinary tract infection is a UTI. It can infect the entire urinary tract system, the kidneys, the ureters, the bladder, the urethra, or you might have just an upper urinary tract infection affecting the kidneys, or lower urinary tract infection affecting the bladder. But microbes usually enter the system through that urethra. And so the common causes of it, one of the most common causes of it we see is catheterizations. Anytime you put a tube up into the bladder, you're causing an area where bacteria could climb up it easier and get up in there easier. Urinary tract infections due to catheterizations is a very common healthcare acquired infection. And it's one of the reasons that we don't routinely use urinary tubes when at all possible. Now, if you're working in a hospital, you'll frequently hear the term CAUTI, C-A-U-T-I. It's catheter-acquired urinary tract infection. And so one of our goals in a hospital is to always get that urinary tube out as soon as we can. And again, it's one of the reasons why we don't generally just use it for incontinence issues. Urological exams, putting scopes, putting instruments up in through the urethra, up into the bladder to look up in there can, of course, open up that area and let microbes climb up it. Intercourse, poor perineal hygiene, so cleaning someone improperly, not doing proper technique of cleaning from front to back, wiping people incorrectly can lead to urinary tract infections. Immobility, when a person can't empty their bladder all the way, it will predispose them to more chances of having a urinary tract infection. And then poor fluid intake. We've mentioned this before. Many times our elderly population just doesn't drink enough fluid. And so it's really important that we really try to encourage fluid for our residents unless they are on fluid restrictions. Now, women, we said, are at a much higher risk of a bladder infection or urinary tract infection. Mainly because, of course, incomplete emptying the bladder, perineal soiling from fecal incontinence puts a person at risk. Poor fluid intake for our elderly population tends to put people at risk. Poor nutritional status. So, all of those things can really increase those risks. So this is kind of a nice picture. It tends to show you, generally, our urinary system is sterile. The vaginal system is not really it's definitely not a sterile system, but it is not usually considered a dirty system like the GI system is, because it doesn't normally have bacteria in it per se. But in your bowel, you normally have bacteria to help you digest your gut. So when you have a bowel movement, you're passing bacteria in it. And that bacteria, again, for a female, you've got the rectal opening, the vaginal opening, the urinary the urethral area. And so this bacteria can climb from the rectum and just easily move here and start going up this urethra. But when a female urinates, of course, that's going to hopefully push the urine and that bacteria out. And so with good cleaning, with normal emptying of the bladder, hopefully this doesn't happen. Now, another really common problem that we tend to see, oh, and just to mention here, urinary tract infections, generally how we treat them is lots and lots of fluids to just keep people urinating and emptying that extra bacteria that's gotten up there out, and then antibiotics. Now, prostate enlargement happens to men, obviously. The prostate is a gland in men, not women. It lies in front of the rectum and just below the bladder, and it actually surrounds the urethra. So the prostate is on both sides. It completely surrounds the urethra. The urethra goes through the middle of it. So as a man ages, when a man gets older, the prostate is more prone to growing, and it's called benign it's benign prostatic hypertrophy or hyperplasia, which is just a growth of the prostate. And benign, meaning it's not cancerous, but it does tend to cause urinary problems because when that prostate starts enlarging, it puts pressure against the urethra and it narrows the urethra because it's growing on both sides, and then a person can't empty their bladder all the way. So it's hard for a man to empty his bladder out. So this here is a normal prostate. You can see the urethra goes, from the bladder. The urethra comes from the bladder, goes through the penis and out. And normally you have the prostate on both sides of it. But as this prostate enlarges, even though it's not cancerous necessarily, though people do get prostate cancer as well, but many men suffer from enlarged prostates. And you can see here that as this is growing and enlarging, it puts pressure here, and now this is narrowing that urethral opening, which makes it hard for them to initiate their urine stream. It makes it hard for them to empty their bladder properly. It does make them more prone to getting urinary tract infections because of that. So common symptoms: a weak urine stream, frequent voiding of small amounts of urine because they just can't empty their bladder all the way, the sense of urgency or leaking or dribbling of urine, frequent urination at night, urinary retention, the urine just staying up in the bladder and not coming out. So there are medications that can help shrink the prostate and medications to help stop the growth of it. They also have these microwave treatments and laser treatments that can destroy excess prostate tissue. For some people, they actually have to surgically have it removed, and that's called a transurethral resection of the prostate, and that's a fairly common surgical procedure for men to have done. Now, another thing that we might see is urinary diversions. So sometimes the urinary bladder is surgically removed, the bladder itself. So cancer is probably one of the most common reasons you're going to see the bladder removed. So cancer and bladder injuries, if it's damaged, if it's not repairable, they may actually have to remove the bladder, and that's your holding tank. Okay, that's that holding tank for those waste products. So often they'll have to have an ostomy. Now an ostomy, remember, is a surgically created opening to the body. So a urostomy is a surgically created opening between, between the ureter and the abdomen. And they will actually put a pouch over the stoma. So if the urine, kind of like when we talked about colostomies, how stool just comes out of the stoma, urine would come out of the stoma and into a pouch. And the pouches are usually changed every 5 to 7 days, or it can be replaced anytime it leaks for some reason. But another thing that they can do with urinary diversions is they can actually make a fake bladder. So what they do here is, so I have the kidneys and the ureters are attached, and normally those ureters come down to the bladder and then it comes out the urethra. Well, if they've had to take the bladder out, what they can do is they can take a section of the bowel. They can actually take a section of the intestines and stretch it out and make a holding tank. So they basically make a new bladder to hold the urine. And then and then there's still from the bladder, this fake bladder they made from the bowel area, this part of it's still going to come to an opening to the skin. But then instead of urine just constantly draining out, what the person can do is they can do like an in and out catheter and then just drain the urine out that way. So there are some kind of really creative ways that they have to try to, make this more bearable for a person, when they've had bladder cancer. Now, the term renal calculi are kidney stones, and risk factors being a white male between the ages of 20 to 40, bed rest, immobility, and poor fluid intake. So kidney stones, what happens is they're formed in the kidneys and they start coming down the ureters, and sometimes they get plugged in the ureters. They're very painful as they're coming down the ureters. And then they can get into the bladder. Usually if they can get through the ureters, once they get into the bladder, it'll usually get past. But sometimes they get stuck up in here. They get stuck up in these ureters, or right here where the opening of the kidney to the ureters is. And if it's something that they can't get to pass on their own, they can do what they call lithotripsy, where they do these pulsations to the area to try to break the stone up. And if that doesn't work, sometimes they'll just have to go in surgically and cut into that ureter and actually take the stone out, depending on the size of it. Stones can be nice and smooth, or they can be, have bumps on them. They can have little edges and sharp, jagged things on them. Very, very painful when they pass. Extremely painful when they pass. And renal stones are made up of different things. So one of the reasons when we talked about specimens, we talked about how if a person had kidney stones, you would always strain the urine. You would run it through a strainer, because we want to catch one of these stones so we can send it down to the lab and have it tested to see what it's made of. There's all different things that your urinary stones can be made of. They can be made of oxalates and struvites, and so they want to know what's making them so they can know better how to treat them, or if there's dietary changes or medications even that can be given to help the formation of them for people who produce them a lot. So people tend to have severe cramping and pain in the back and side just below the ribs. It's called the flank area. So it starts right back here, which is about where your kidney is, and it kind of wraps around to the front side. And this is a really typical thing. People just have excruciating pain as this thing is trying to pass. They might be nauseated, vomiting, fever, difficult, painful urination, urinary frequency, burning on urination, olguria, which is a scant amount of urine, especially if the stone is blocking the ureter and the urine can't get through, hematuria, which is blood in the urine, cloudy urine, foul-smelling urine. Those can all be signs of it. So our treatment is pain relief, drinking lots and lots of fluids, straining all of the urine, and if we can't get it to pass on its own, like I said, there may need to be surgical removal. And then kidney failure. In kidney failure, the kidneys do not function, or they are severely impaired. So usually you can tolerate about 25% of your kidney not working and still function pretty well. After about 25%, people generally start having some issues with their kidneys that it's more noticeable. But if the kidneys aren't working properly, your kidney helps remove sodium and water removal and waste removals and helps produce certain hormones. So if a person's not having a healthy kidney, they might have fluid overload. And if a person's retaining too much fluid, they're more prone to high blood pressure, hypertension, and to heart failure, because your heart's got to work harder to pump all that extra fluid through. You'll have elevated waste in your body. So normally your kidneys help filter out the waste, I said, in the form of urea, but there's also creatinine and potassium that gets passed, and changes in hormone levels that control your blood pressure and making your red blood cells and uptaking calcium. That's not going to work properly either without a proper kidney function. So in acute kidney failure, there's severe decreased blood flow to the kidneys. Causes can be severe injury or bleeding, myocardial infarction, heart attack, heart failure, burns, infection, severe allergic reaction. They will need hospital care. They're going to need to go into the hospital. And some people, it will end up turning into a chronic renal failure issue. So if it's acute, usually, hopefully with medications, restricted fluids, and diet therapy. Usually when patients have kidney issues, we do low protein, because it's kind of hard on the kidneys to filter a lot of protein out. So we do low protein, low potassium, low sodium diets. chronic renal failure where the kidneys cannot meet the body's needs. The nephrons in the kidney are destroyed over years of time. Really common causes are hypertension and diabetes. So other causes, infections, urinary tract obstructions, tumors. But once signs and symptoms, once you get about 75% of your kidney function lost, then we're probably going to be looking at needing dialysis. So treatments, fluid restrictions, diet therapy, drugs, and dialysis treatment. And dialysis is the process of removing waste products from the blood. There's what we call hemodialysis, where the person has a shunt put in or a big port put in. And what happens is that they put a needle into that. It goes out of the body, the blood goes out of the body and runs through basically an artificial kidney, filters the waste out, and then the blood pumps right back into their body. And it takes a long time for this process to happen. People that need hemodialysis usually go about 3 times a week. And when they're there, they might be there for 6 to 8 hours, 3 times a week. I mean, it's a big chunk of their life that they have to spend this way. There's also what we call peritoneal dialysis, which uses the lining of the abdomen cavity, the peritoneal membrane, to remove waste and fluid from the blood. And some people can do that from home. But this is a dialysis machine, and you can see, the blood, there's usually 2 big tubes. One is taking the blood out of the body, running it through this artificial kidney that takes the waste out, and then the other side, it'll put the blood back into the body. And I think we will stop there.